research into sex addiction and betrayal trauma, why is it important?
So that we know what we're doing. I can have great intentions for treating someone who's a sex addict or has compulsive sexual behavior problems or betrayal trauma, and my heart's in the right place and I
Yeah.
want to do it. But what if I'm not actually helping? What if I don't actually understand what the real problem is, or where the problem comes from, or what is most effective, treatment A or treatment B, or understanding different nuances as to why A versus B would be more effective for this person. My intention can be in the right place, but maybe I actually, need a little more knowledge to
Yeah.
pair with that intention so that the work I'm doing can be effective. That's what research can help us with.
When you say that, the thing that comes to mind is we just are on the tail end of completing and publishing a lot of research around the genomes
Yes.
that show up in how the genomes for
Hmm.
sex addicts are different from the general population, and also the neurobiology of what's
Yeah.
going on with sex addicts. And one of the things that is coming out of that research is this very clear understanding that reward deficiency syndrome, which we see with a lot of addictions, we see it with depression and anxiety, a lot of that stuff that neurologically actually changes the way the brain functions, is one of the things that we're seeing very prominently in people who are struggling with sex addiction. And when we understand, oh, there's a neurological piece here,
Right.
their ability to move their focus away from something that their addict brain is hyper focused on is
Yeah.
significantly impaired. Their ability to contain their behavior is significantly impaired. Their ability to sort of lean into relational empathy has
Hmm.
been neurologically impaired. And
That's
when we
right.
understand that, the way that we approach and treat them is very different because, if I'm going to tell somebody, hey, don't do that, you shouldn't
Hmm.
do that, it's a very different conversation than saying, look, neurologically, you think your brain is a sports car and you
Right.
think it's going to corner on rails and you think it's going to stop on a dime. And the reality is, because of the neurology of your brain, it's a loaded moving van.
Mm.
And you have to consciously live your life knowing that you're not going to, navigate around those corners well, and you're going to have to stop yourself well before you think you do. And
Yes.
and when we understand sort of the research behind that, and that's just the neurology, there are plenty of other places, it
Right.
really does help us to know what are we dealing with, and
Yeah.
so how do we most effectively help the people that we're treating.
Absolutely.